My name is Dr. Arora. I own Arora Periodontics up in Northern California, and I've been in practice for the last 15 years. I've been doing all-on-4 cases for the past 15 years now, and the way we do it now is probably the most digitally advanced way to do this case. The case we are presenting today is a patient by the name of Brian. He has a failing dentition on the maxillary arch. Our plan was to offer an end-to-end digital solution in which, after we have taken the records with his intraoral scans and CBCTs and smile design, we have then used a tool called X-Guide to accurately place our implants in his upper jaw. Once the implants were placed, we then use fast mapping, which is another module of X-Guide, so that we can accurately get the exact positioning of these implants mixed with an intraoral scan and some software that gives us the exact way we want a temporary to be done. Once we have this information, then we can use our 3D printers with SprintRay, and we're able to deliver him in a matter of hours the most accurate and the most digitally advanced way of doing a full arch case.
I'm Brian, this is my story. I'm a local handyman. I deal with a lot of customers on a daily basis, so teeth really affect how I communicate with people. I can't speak right sometimes, you know, and they're not the great, they don't match the greatest, and self-confidence, you know, when you don't feel right about your teeth, you can't smile properly, and so it's a big detriment to your self-confidence. I hide my smile, which is a big, you know, kind of changes my personality when you have to hide your smile. So not just every conversation, but every word of every conversation. So I love to whistle. I can't whistle properly with this piece in. Once I'm done with this procedure, the things I absolutely look forward to is being able to eat ribs and corn and all the barbecued stuff I love, as well as boost my self-confidence, being able to speak properly and smile with my customers. That's going to be a big asset.
My name is Debbie Grant. I am the lead RDA in the office. I take care of all the records for the hybrids, make sure our workflow goes well, and the surgery goes off without a hitch. The difference in my workflow between analog, our old way we did it, and the new way, the digital X-Guide way, is night and day. The workflow has changed so much that it used to take 45 minutes at least with me in the office, and now I can get it done in 10 minutes and off to the lab, and makes our surgery so much shorter. We would have to wait 4 to 6 weeks for the lab to make a case for us, and then you would have to approve it, and then wait another 3 weeks for them to put it together to ship it off to us, and that would just take way too long. So now we can do an iOS scan, a CBCT in the office, send it to the lab, have everything done in a week, and the patient will walk out of the office in a hybrid that is printed in our office and painted to look like nobody ever knew it. And the best part about it is the patient does not have to be asleep. They're awake. There's less pain when they leave the office. There's less pain overall. In 3 months, they get the permanent one, and it's great. It works well. It's fast. That's what I say. It's fast.